Welcome to the Omnidental Podcast. You know, right now, probably in bathrooms all across the country, people are doing things to their own mouths that honestly belong in a science fiction horror movie.
Oh, absolutely. It's genuinely terrifying.
It really is. I mean, we are talking about using standard office paper clips or just ordinary rubber bands to try and literally force human bone into new positions.
Right, which goes against every rule of biology.
Exactly. So today, we are taking a deep dive into exactly why this is happening, the permanent structural damage it causes, and, well, looking at the professional antidote to all this chaos.
Because there is a very clear alternative, thankfully.
Yes, for sure. We are drawing from a brand new article published on April 29th, 2026 by Dr. Belis Poles. It's titled, The Perils of DIY Orthodontics and the Value of Professional Care. And alongside that, we're going to explore the comprehensive, highly advanced service offerings of Omnidental of Arlington Heights.
It is a massive contrast to explore, you know? On one side of the spectrum, you have the absolute pinnacle of modern technological healthcare, where professionals treat the entire facial architecture.
Right.
And on the other side, you have people resorting to the most primitive, frankly dangerous methods imaginable just to alter their physical bodies.
Yeah, and we really need to look at the tension driving this. I mean, we all understand the universal desire for a perfect smile, right?
Yeah.
Everyone listening to this wants to feel confident.
Of course. That's a very human thing.
Right, and we naturally want things to be affordable. But when that desire collides with these internet-fueled, do-it-yourself teeth-straightening hacks, the results are just shocking.
They really are.
So if you've been targeted by an ad for a cheap online fix, or maybe you know a teenager who's tempted by an at-home kit, this deep dive is crucial. We're talking about protecting your fundamental health and, frankly, protecting your wallet from utter disaster.
Because it will become a financial disaster, without a doubt.
Exactly. Okay, let's unpack this. What exactly are people doing to their teeth at home? Because when I was reading through Dr. Pohl's article, the sheer mechanics of it just blew my mind.
I know. It's hard to even conceptualize.
It really is. It's not just like trying to fix a car's transmission using office supplies. It's more like pouring super glue into the gears and hoping it makes the car run faster. You might think you're making a mechanical adjustment, but you are just destroying the machinery from the inside out.
That is a highly accurate way to frame it.
Right.
Because the human mouth is an incredibly complex mechanical and biological ecosystem.
Right.
Dr. Poles points out that people are completely bypassing trained professionals.
Yeah.
I mean, at the lower end of the danger scale, you have these unsupervised online aligner kits.
The ones that just show up in the mail.
Exactly. They arrive in the mail with absolutely zero in-person dental oversight. But, you know, the trend gets significantly more extreme than that.
Yeah, the paper clips.
Yes. People are literally taking thick metal paper clicks, bending them, and attaching them to their teeth. Or they're using standard household rubber bands to try and pull gaps closed.
The idea of putting a rigid piece of office metal into your mouth to shift bone structure, it literally makes my teeth ache just thinking about it.
It's visceral, yeah.
But practically speaking, what happens the second someone tries to apply force with a paper clip?
Well, the immediate physical trauma is brutal. The source details how these paper clips do exactly what you would expect a sharp piece of unrefined metal to do in a soft, wet environment.
Slicing things up.
Yeah, they violently cut the gums and the soft tissues of the mouth, but the deeper permanent damage actually happens to the enamel.
The outer layer of the tooth.
Right. Enamel is the hard, protective outer shell. It's actually the hardest substance in the human body. But when you scrape and gouge it with a rigid paper clip, you create microfractures and scratches.
Oh, wow. So you're just ruining the tooth shield.
Exactly. You are essentially stripping away the tooth's only defense mechanism. That invites in severe decay and bacteria. It creates immense pain, and this is key, that enamel does not grow back.
I want you, the listener, to stop and just visualize the sheer physical force required to move a human bone. Because your teeth are not just, sitting on top of your gums.
No, not at all.
They are deeply anchored into your jawbone. The idea that a household item, something you use to clip a stack of receipts together, is somehow biologically qualified for the highly calibrated job of shifting a skeletal structure It defies all logic.
It completely ignores human anatomy. What's fascinating here is the underlying biological mechanism of the mouth. Moving a tooth isn't like sliding a block of wood across a table.
Right.
It is more like moving a wooden post through wet cement. For a tooth to move safely, the bone actually has to break down on one side of the tooth.
Break down.
Yeah, it's a process driven by cells called osteoclasts, and then it has to completely rebuild itself on the other side using cells called osteoblasts.
That sounds intense.
It is. This requires incredibly precise, measured, and sustained force. Because people don't understand that biology, they use something completely uncalibrated, like a rubber band.
Right, the rubber bands.
And the results detailed in the text are horrifying. Because of the tapered shape of a human tooth, when you place a rubber band around it to pull two teeth together, the band naturally wants to slide down the slope.
Down towards the gum.
Exactly. It detaches from the visible part of the tooth, slides completely under the gum line, and just disappears.
Which is a terrifying visual. But let me push back on this for a second, or at least ask a clarifying question for anyone listening.
Sure, go ahead.
If a rubber band is just a simple piece of elastic, how does it cause so much destruction so quickly? Especially when we know that actual orthodontists use elastics in professional braces all the time.
That is the critical distinction, actually. It comes down entirely to control the vector of force and the biological environment.
Okay, make that make sense for us.
When a professional uses an elastic, it is anchored to precision brackets. It cannot move. But when a DIY rubber band slips under the gum line, it becomes this invisible rogue tourniquet.
Oh, man.
It travels down and directly attacks the periodontal ligament, which is the fleshy tissue connecting the tooth to the bone.
So it's basically cutting it off.
Yes. The source states explicitly that this rogue elastic strangles the root of the tooth. It cuts off the blood supply.
That is, wow.
It leads to massive acute infections, severe gum disease, and ultimately permanent tooth loss. You are amputating your own tooth from the inside out.
Because it's happening out of sight.
Exactly.
Yeah.
Because it happens under the gum, you often don't realize the severity until the tooth becomes loose and literally falls out of your head.
So it's not just about applying arbitrary pressure to make a smile look straight. It is an intricate architectural project that has to be micromanaged.
Precisely. Dr. Poles outlines 4 critical interconnected factors that a dental professional must comprehensively assess to create a custom treatment plan.
And those are...
First is your bite, how your upper and lower teeth mechanically meet. If you move one tooth, you change the entire bite dynamic, which can lead to jaw pain or fractured teeth.
Right.
Second is your jaw position. Third is your gum health. If your gums are already compromised, applying force will just tear the tooth right out of the bone.
Yikes.
And fourth is the overall tooth alignment. Without taking panoramic x-rays and physically examining all 4 of these elements, attempting to move teeth is a guaranteed path to permanent, irreversible damage.
Here's where it gets really interesting. Let's look at the psychology behind why people take this massive biological risk.
Ooh.
It's an economic illusion.
A total illusion.
People are drawn to these mail-order kits or rubber bands because they genuinely believe they are saving a few $1,000s. But the paradox is that trying to protect their budget ends up entirely bankrupting it.
That is the hidden, devastating trap of these quote-unquote cheap fixes. The text is very transparent about these downstream costs.
Yeah, you don't just walk away from this.
Right. When someone attempts DIY orthodontics to save money and it causes the kind of bone or root damage we just discussed, they don't get to just reset and go back to square one.
Like a video game.
Exactly. No response here. They are now in a severe medical deficit. Patients are forced to pay for advanced, highly invasive corrective treatments. You aren't just paying for braces anymore. You are paying to rebuild the foundation of your mouth.
That makes the cost-benefit analysis completely upside down. Because once that root is destroyed by a rubber band, or the enamel is gouged by a paper clip, you need a completely different, much more expensive tier of medical intervention.
You really do. The source details the specific corrective procedures that become mandatory at that point.
Like what?
Well, to fix the damaged enamel and fractured teeth, you are looking at custom dental crowns. A crown is essentially a tailored porcelain cap that completely encases the damaged tooth to restore its size, shape, and strength.
And if the tooth falls out completely?
If the DIY method resulted in tooth loss, you are now looking at full dental implants. This involves surgically placing a titanium post deep into the jawbone to act as an artificial root.
It sounds expensive.
It is. You have to wait months for the bone to heal around it and then place a fake tooth on top. When you factor in the thousands of dollars required for surgeries, implants, and crowns, the text proves that seeking safe, professional orthodontic treatment from the very beginning is overwhelmingly the more affordable choice.
It is the ultimate example of how cheap can be incredibly expensive.
Unbelievably expensive.
So if the DIY route is an absolute minefield, we need to talk about the alternative. We need a safe haven. And that brings us to the conceptual shift we need to make today. Moving away from primitive home remedies and looking at the pinnacle of comprehensive modern dentistry.
Yes, the smart route.
For you, the listener, the source material points directly to Omni Dental, located at 305 E. Rand Road in Arlington Heights, Illinois.
And leading Omni Dental is Dr. Billis Poles, DDS. What really stands out in his profile is how perfectly suited his background is for this exact conversation.
Oh, definitely.
He brings over a decade of clinical experience, but crucially, he has specialized, advanced training in treating dental injuries and emergencies.
Which is the exact skill set you need if you have just subjected yourself to a DIY disaster.
Exactly.
If you've compromised your jawbone or have a rogue elastic embedded in your gums, you don't just need a standard cleaning. You need someone highly trained in complex oral trauma.
You need someone who understands how to salvage failing biology. But alongside that high-level clinical expertise, the text emphasizes his patient-first approach.
Meaning what, exactly?
It's about treating the patient comprehensively, ensuring that every single visit is tailored and respectful. And if we connect this to the bigger picture, Omni Dental is treating these complex cases by pairing human expertise with state-of-the-art advanced technology.
Which sounds great in a brochure, but what does that advanced technology actually mean for the biology of the patient sitting in the chair?
In practical terms, advanced technology like 3D imaging and laser dentistry leads directly to superior accuracy in diagnosis. It means treatments are far more efficient.
That makes sense.
But the most important philosophy mentioned in the text is that technology allows for highly conservative care.
Conservative in what way?
Conservative care is a vital concept in modern dentistry. It means the dentist relies on precision tools to only remove or alter the absolute minimum amount of tissue necessary to restore health.
Always keeping as much of the real tooth as possible.
Exactly. The goal is always to preserve as much of your natural tooth structure as biologically possible, because natural tooth is always superior to a synthetic replacement. Plus, this precision drastically enhances patient comfort and speeds up recovery times.
I was also really impressed to see their commitment to being an environmentally conscious practice.
Yeah, that's a great detail.
They are actively minimizing their environmental impact through sustainable clinic practices, but without ever compromising on the sterility, quality, or safety of the medical services. It is a very thoughtful, modern approach to how a healthcare facility should interact with its community.
It reveals a holistic view of medicine. They are caring for the microenvironment of the patient's mouth while also taking responsibility for the macroenvironment we all share.
I love that.
And that holistic philosophy extends directly into the sheer scope of treatments they offer. They don't just fix teeth. They look at the entire architecture of the face.
This is where I was genuinely amazed looking at their service breakdown. It is incredibly vast. So what does this all mean for a patient walking through their doors?
It means Omni Dental functions as a true comprehensive hub. Let's break down the mechanics of what they actually do, because it is fascinating.
Let's hear it.
On the dental side, they handle the entire spectrum of general dentistry, deep cleanings, extractions, root canal therapy, but they also utilize laser therapy for gum disease.
Lasers instead of scalpels.
Right. It uses targeted light energy to vaporize diseased tissue and kill bacteria under the gums without the need for traditional scalpels and stitches. They even provide sleep apnea appliances.
Sleep apnea appliances at a dentist. That's a great example of bridging the gap between oral care and overall physiological well-being.
It's a perfect overlap of disciplines. A custom sleep apnea appliance physically repositions the lower jaw slightly forward while you sleep.
To keep the airway open.
Exactly. This prevents the soft tissues in the back of the throat from collapsing, allowing the patient to actually get oxygen during REM sleep, all without needing a clunky CPAP machine.
That is so convenient.
And then, moving into restorative work, they handle highly complex scenarios, like all-on-4 dental implants.
Let's define that, because all-on-4 sounds like a mechanic's term. What is happening biologically there?
It's a revolutionary technique for someone missing an entire upper or lower set of teeth. Instead of needing an individual titanium implant for every single missing tooth,
Which would be a nightmare.
right, which requires massive amounts of bone and surgery. Instead, they strategically place just 4 angled titanium posts into the jaw.
Just 4.
That's four. These four pillars are so mechanically sound that they can support an entire permanent arch of new teeth. It is an incredible feat of biomechanics.
Wow.
And if a patient's jawbone has deteriorated from, say, a DIY orthodontics disaster, they also perform the bone grafting necessary to rebuild that foundation.
That level of reconstruction is incredible. And for those just wanting a safe, professional alternative to those dangerous mail-order kits, they offer the cosmetic solutions too, right?
Yes, the safe alternatives. They provide Invisalign aligners, which use advanced 3D modeling to safely and predictably move teeth. They also do full smile makeovers, teeth whitening, gummy smile correction, and prosthodontics.
Orthodontics.
Yeah, which is the highly specialized field of designing and fitting artificial replacements for teeth and other parts of the mouth.
That alone is an incredibly impressive, medically dense list for a dental practice. But then you look at their aesthetic services, and they are treating the entire facial and body canvas.
It's a huge array of services.
And at first glance, someone might wonder why a dentist is doing aesthetics, but it actually makes perfect sense. Dentists are maxillofacial experts. They study the muscles, nerves, and bone structure of the face more intensely than almost anyone else in medicine.
That is exactly the rationale. Their deep understanding of facial anatomy makes them uniquely qualified for these procedures. Their aesthetic menu is staggering.
What's on it?
They offer injectables like Botox and dermal fillers. And a surprising fact about Botox in a dental setting, it's not just for smoothing wrinkles.
No.
No, Botox is highly effective for treating TMJ, temporomandibular joint dysfunction, and severe teeth grinding.
No, because it relaxes the muscle.
Exactly. By injecting it into the masseter muscle, they can paralyze that overactive jaw muscle just enough to stop the destructive grinding while still allowing you to chew normally.
That is a massive quality of life upgrade for someone dealing with chronic jaw pain. And they also utilize something called PRF, right? Platelet-rich fibrin?
Yes, PRF is fascinating regenerative medicine. They draw a small amount of the patient's own blood, spin it in a centrifuge to isolate the concentrated growth factors and healing proteins, and then reintroduce it to the body.
It speeds up healing.
It accelerates healing after oral surgery, but it is also used in skin rejuvenation to stimulate natural collagen production. Speaking of skin, they offer microneedling to trigger the skin's natural healing response, laser pigmentation removal, acne scar treatments, IPL photofacials, and deeply hydrating hydrofacials.
And it still keeps going. They have a dedicated permanent makeup department.
They do. They offer microblading for eyebrows, lip blushing to add subtle color to the lips, and highly specialized medical tattooing.
Like what?
Like nipple pigmentation for breast reconstruction patients, as well as scalp micropigmentation to simulate the appearance of hair follicles.
That is life-changing stuff for a lot of people.
It really is. And finally, they offer extensive body treatments, including laser hair removal, body sculpting, and even IV drip therapy to deliver hydration and vitamins directly into the bloodstream.
It is truly a holistic, all-encompassing hub for both internal health and external aesthetics. You could literally go in to have a complex bone graft or get Invisalign instead of a dangerous DIY kit and follow it up with an IV drip and a hydrofacial.
You really could.
It is all happening at 305 E Rand Road in Arlington Heights. And just so you, the listener, know exactly who they cover, they are serving a massive footprint in Illinois. They provide this comprehensive care to Arlington Heights, but also nearby communities, including Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
And for accessibility, they operate Monday through Friday from 10 a.m. to 6 p.m. If anyone in those communities is looking to transition from risk to professional care, their contact number is 847-483-8833.
So, to synthesize the journey we've been on today, we started in the absolute wild west of the internet, looking at the genuinely barbaric risks of using paper clips and rubber bands under the gums just to save a few dollars up front.
And we saw the realities of those choices.
Right. We saw how those DIY methods completely ignore the complex biology of bone resorption and end up causing permanent damage that costs a fortune in advanced corrective surgeries.
So true.
And then we transitioned to the absolute opposite end of the spectrum, the reassuring, highly regulated, technologically advanced care offered by Dr. Poles and his extensive team at Omni Dental.
It is the ultimate contrast between chaotic, unnecessary risk and guaranteed, biologically sound professional safety.
So our call to action for you, the listener, is simple. If you're experiencing tooth discomfort, if you've tried one of these online kits and are feeling structural pain, or if you simply want a safe, scientifically guaranteed path to that perfect smile we all want, do not wait.
Please don't wait.
Professional care is the only safe option for your physical health and your long-term finances. Reach out to a professional before permanent damage is done.
This raises an important question, and it's something I think we all need to reflect on as we close out this topic.
Let's hear it.
In an era where we can get almost anything, our groceries, our electronics, our entertainment delivered directly to our door with a single, frictionless click, have we dangerously confused the convenience of consumer goods with the highly specialized biological reality of our own bodies?
That is a brilliant and necessary point to leave on. Thank you so much for joining us on this deep dive. We appreciate you taking the time to explore this fascinating and critical topic with us, and we will catch you on the next one.